you for tuning in to the Monday edition of the Oakland County Megacast. I'm Ronnie Dahl here in the studios alongside Tyler Keefe. Boy, the weekend flew by.
It did, really quickly.
Did you do anything for Halloween?
For Halloween, did I do anything? Well, I watched a glorious 4 hours of football. And it was the spookiest and most pleasureful 4 hours of football watching I've maybe ever experienced. Watching the Michigan Wolverines lay an egg in the big house, and my Spartans somehow remember how to play the game of football.
It was crazy.
It's beautiful.
The outcome of that game, because pretty much going in, everyone thought Michigan State didn't have a chance.
Oh, myself included. Yeah, no, I think any Michigan State fan that tells you they thought that we had a chance of winning going into that game is lying to you. That doesn't mean we can't be happy when it ends up happening. Denial is not just a river in Africa.
How do you lose to Rutgers and then win against Michigan? It was like two different teams
I don't know.
playing.
I'm starting to think that maybe Rutgers is a Big Ten powerhouse and a national championship contender. It's 2020. Anything can happen.
That is so true. Let me get out and
Whatever
talk here. The Lions, though, didn't have as much luck yesterday.
Some things never change.
Yeah. But the week before was such a great ending.
Yeah, it was a great ending against a one-win team. I don't know. It's like, look, I took that with those last two wins with a grain of salt from the Lions because they were playing, frankly, against terrible teams and went up against a halfway decent team on Sunday against the Indianapolis Colts, and then they got rocked.
How long do you think the coach is going to last?
Way longer than he should. That's what I think. I mean, he's already outstayed his welcome.
You know, someone should add up the amount of money the Lions, the Fords have been paying some of these coaches that do not finish their contracts. Because they pay them out.
No, they do.
If you're
yeah,
going to fire me and you still pay me a few $1 million,
right,
go
what
ahead,
do I
fire
care?
me.
Go for it.
You know? I mean,
Yeah.
I think the Lions are jinxed. They really are jinxed.
Yeah, no, I think the curse of Bobby Lane is a much more potent curse than the curse of the Bambino that affected the Red Sox for over 100 years in Major League Baseball.
So the answer is
we're cursed. It's just that's the spookiest thing that you can possibly think of at this time of year is that there's some sort of a curse on you, and there definitely is on the Detroit Lions. It's the only logical explanation.
Oh. So a lot happening, though, news-wise over the weekend. The talk is, according to Kwame Kilpatrick, the former mayor of Detroit, according to his sister in a tweet, Kilpatrick may be getting out of prison this week due to a COVID-19 relief. That will be interesting to see if that does happen, although a lot of people actually thought President Trump would have pardoned Kwame long before now, because if that would have happened, maybe he could have come to Detroit to help sway a few votes here and there. That did not happen like people anticipated was going to happen, I think, 6 months ago? So now it appears as if, according to his sister, Kwame may be getting out of prison a little bit early. The Department of Corrections, or the Federal Bureau of Prisons, however, says they have no official word on that. So that's going to be interesting to see what happens in that case. There was another politician in Ohio who was also sentenced to a long-term prison sentence for bribery and public corruption. He got a similar sentence as Kwame, and he has been released as well due to COVID. So it could happen.
Yeah, it's entirely possible that could happen. It's expected to happen, and I mean that's what's been going on with a lot of these prisons is the nonviolent offenders they're releasing, and they're keeping track of them while COVID's still going on, trying to prevent what's been a big problem, which is the spread of COVID-19 in our prisons.
Yeah, we had the spokesperson from the Department of Corrections on last week talking about that. You do all that you can, but when you have people living together in confined spaces, it's very hard to maintain the spread of this virus. And they are trying to do what they can, but one of those things to try to help the issue is to allow for early release of the nonviolent prisoners. So that'll be interesting to see if that happens. I have a question for you.
Okay.
If you go to a restaurant today to get lunch or something, are you going to give your actual name?
Yeah, just in case there are people that are going in there that aren't wearing masks, that are wearing their masks over their mouth but not their nose, breathing all over everything, and I happen to catch their coronavirus. And sure, I'd rather be able to have someone call me and say, yeah, you might have coronavirus, you might want to stay home. So yeah, I think I would do it, or I would just avoid going there altogether.
I find it interesting. A lot of people on social media right now are saying they have a funny feeling there's going to be a lot of Ginnies, 8675309.
Oh, I wouldn't be surprised. Yeah, I think plenty of people are going to go fill in that out falsely. But you know what? Look, we give our phone numbers out to Kroger and to Meijer and the other places to get free coupons. What's the difference between giving them out to a restaurant just in case a deadly virus spreads there? You know?
I don't think I gave my number to Kroger. Huh.
I don't know.
Or Meijer. But yeah, so that does start today. So if you're going out to breakfast or out to lunch today, if you stop into a restaurant, you will be required to, beginning today, give your name and your contact information. So if there happens to be an outbreak at that particular location, then the Department of Health can try to contact you to let you know that possibly someone may have been in that place around the same time. And I know that I think you have a sign in time, but I don't think there's a sign out time. So
also interesting.
It's and you look at a lot of these situations where the government puts in these programs to try to stop the spread, but then in the reality of how it actually works is going to be two different things. So speaking with some restaurant owners over the weekend, obviously they feel the frustrations on so many of these situations, because one being that a lot of times these decisions are made and they're made quickly and they don't have time to adapt, but everyone is making changes. I just saw in the headlines before we came in here, West Bloomfield School District is now going to start all remote. They had been doing the hybrid situation. They are going to go all remote for the time being due to the uptick of cases right now.
Yeah, it doesn't entirely surprise me that's starting to happen in West Bloomfield. It'll probably happen in some other school districts too, should we continue to have this upward trend of positive cases in southeastern Michigan and across the state. I mean, it's getting serious again. Or at least it's trending in that direction. Schools obviously want to be on top of that and prevent the spread of COVID-19. So if they have to take a step back, that's why they've made these plans all throughout this process of being able to, okay, if we move forward, we can move forward, but we're always at a capacity where should something happen and we need to, for the safety of our students and our staff and our faculty, take a step back, that we can do so.
We are in the final countdown, but even the surge is having an impact on this election eve, because with the coronavirus cases surging across Michigan, election clerks are moving to replace poll workers who have dropped out after contracting the virus, reporting being exposed to it, or saying simply they're just too nervous to work the November 3rd election. Shortages could lengthen in-person voting lines or slow a massive absentee ballot counting effort, but officials say there's no cause for panic because local and state officials have spent weeks recruiting reserve workers to prepare for that second wave. In fact, many of those recruits have already been assigned, but the state is building what it hopes will be a 1,500-person emergency reserve pool of workers who could be deployed to local communities on election day. I will be so happy when this election is over. One of the good things about living in Kegel Harbor, it's a small city. We've never really had lines. I mean, there's some, but not to the length that we're seeing in some of these other states, or even what we've seen in the past. Like, I believe in Detroit, some people were waiting, 4, 5, 6 hours to be able to vote. We don't seem to be having those problems here. I don't recall really any of the big issues in West Bloomfield either.
Yeah, it hasn't been a big issue from my recollection. I know this morning, having been over at West Bloomfield Town Hall, we're providing some AV help over there as they're working through their absent voter counting board, and they need to make announcements across the boardroom and across just the outside area in the hallway where they are doing some of these day before operations, beginning the early processing of some absentee ballots, and of course tomorrow as their absent voter counting board is there. And there was already lines on both sides of the building to either submit last minute ballots or register to vote in person today and get your ballots in. And it is the last day, I believe, you can get an absentee ballot up until the end of the day today for this election. Otherwise, you can still go in, of course, and register on the day of and vote in person at the clerk's office. But already seeing some, not big lines, but lines nonetheless, as people are making that last-minute push to get their votes in or get their questions answered. Maybe they're going in and want to change some of their votes and spoil their ballot, vote again in person to replace the ballot that they had submitted. So not as bad as we've seen in some other major cities where, like you said, those lines can be several hours long as people are trying to vote early or just vote in general. We don't generally have those kinds of problems in our local area. Heck, over the weekend I voted in person at my local clerk's office in Wixom, and there was only a few people there. I went early right after they opened, but I was back and forth between there throughout the rest of the day when they had their open hours, and lines were was pretty non-existent, actually, maybe a couple people at a time.
Yeah, I'm pretty old school on this, though. I still like to go in person to
So do
put
I.
my little ballot in the box, watch it get counted, go through the machine, and then get my I voted sticker. So I'll be waiting until tomorrow.
I was pleasantly surprised. I did get my I voted sticker. I
You
didn't put it on, and what I do with my I voted sticker is I have a travel coffee mug, and I put them on the travel coffee mug, and I put that I voted sticker aside. I will not put it on until election morning.
Well, there you go.
I will not do it until that day of. It's a tradition. I normally like to vote in person too, but I figure I'm going to be so busy tomorrow that I may not be able to get to my poll in time. And I certainly, if there are any chances of being lines, if I can avoid standing in line for a few hours by submitting my vote in person at the clerk's office, why not save myself and another voter some time?
There you go. That's good. That's good. I will say one of the good things coming out of this, I think, is going to be that so many more people are voting.
Yes.
And we should be doing this every election anyway. But it's a positive coming out of this election. It's a crazy election, so we'll see what's going to be happening come post-election day tomorrow. Although, it's really going to be an election week. We're most likely not going to have the results. So also, one of the other things, and remember, it's getting colder out. What's that mean? Deer season. So it could scatter some of the COVID-19 cases. There's a lot of concern prior to going into the deer hunting season. Health experts are worried about this because so many people hang out together. You're in cramped cabins. You're playing cards. You're, eating together. It's a tradition for so many people, those Michigan deer camps. And there's more than 500,000 hunters during deer season. That's the stuff of nightmares for state and regional health officials battling to contain the fast-spreading new coronavirus. 15-day firearms season starts November 15th, and already licensed sales have surged ahead of last year's pace. Health experts are worried people from different households will gather indoors, share foods as well as drinks, and then adding to the concern is once that trip ends, hunters are going to be returning to the various communities, then gather for the holidays, increasing the potential for the spread of the virus. So many of these traditions, people are not going to cancel how they've been living in these traditions. For so many people, it's ingrained in what they do. They get together with their buddies and they go on these, hunting trips. And so going into, because now everyone's going to be indoors because it is getting colder. Like yesterday, it was freezing. It was snowing yesterday. It was crazy. And you go indoors. And so then it's going to be around Thanksgiving time as well.
Yeah, it's gonna be an interesting year for the deer hunters and other hunters too. That some may stay home because of COVID-19, and others may have to be extra cautious because you are leaving your hometown. You are going into another area. You might go into the town and interact with some of the local people. And of course, if you're coming in and you're asymptomatic or you're coming from a high volume COVID-19 area into a lower volume COVID-19 area, you certainly don't want to be someone that's patient zero in an outbreak there. So. Got to be careful, but people are going to keep these traditions going. If they're still permitted to do so, I think that there's going to be a large number of people that will still do so and just have to take some extra precautions. But generally, when you're going on these trips, you're kind of keeping to yourself anyway. You're already taking a lot of safety precautions with your firearms and with your proximity to other people. So hopefully that will mean that this potential for scattering the virus during deer hunting season will be minimal, if at all.
Another popular thing to do for so many people is to head to New York for the shopping season. But now, if you are planning to go to the state of New York, if you want to go to the Big Apple, you now have to test negative for COVID-19 at least 3 days before arrival. The change replaces the state's 14-day mandatory quarantine policy, comes as New York reports a 7-day positivity rate of 1.49%. That's the third lowest in the country. Under the new rules, travelers must get tested within 3 days prior to landing in the state. Here's the other part. So once you get there, you then have to quarantine for at least 3 days upon arrival. And then you can get tested on the 4th day of quarantine. And if you're negative, then you can go out and you can enjoy the city of New York and be there for the trip that you want it to be. So I guess really what they're saying is do not plan on coming to New York for a weekend getaway because you'll be quarantined the entire time.
Yeah, very similar to what their almost equally as stringent policies were earlier on in the pandemic in the very initial portions where you had to quarantine for that entire 2-week period of 2-week incubation period altogether. Now with our testing, generally you can get a definitive positive or negative test about 3 days after a potential exposure. So that's 3 to 5 days after a potential exposure, which is why they have that regulation in place for a relatively short quarantine in the state. But nonetheless, if you're going there for a short trip, that can take up half of your trip if you're going there for a week. And if you're just going there for a weekend, I mean, it's a nice round trip going. And you technically do go to New York. You just don't stay there very long.
Right. But I do have a lot of girlfriends. They like to go to New York to do their holiday shopping, like right after the Thanksgiving season. So if you're following along with us, just so you know, you can find all of the day's headlines on civiccentertv.com. Just click on coronavirus, and there we put the latest information, the latest headlines. Also, at the top of the page there, we have direct links to the CDC, the state of Michigan. So if you want to find the latest in the orders coming out of the health department or to read them for yourselves, you can do so there. Oakland County, as well as all other local municipalities. I have not had any caffeine this morning. So I'm trying to go off of caffeine, and I'm still in sleepy mode.
Yeah. It pulls you back. It really does. It tries. It has a lot of different strategies.
It's a hard habit to break.
It is.
Okay, so we're going to take a quick break here on the Oakland County Megacast. We have a lot to get to in today's show. We are going to be starting out speaking with a professor of history over at Oakland University. I'm excited to hear what she has to say, especially talking about the election and how does this election compare with so many in the past, many of them that we have long forgotten about. Then we'll also be speaking with Michigan Women Forward. They'll be sharing with us some of the work that they're doing to help promote women in business and how they are doing all of that in the middle of a pandemic. We're going to also get someone from the West Bloomfield School District on with us to talk about the news that just came out this morning that they are going to be going back to remote learning. And then we'll also be speaking in the second hour of the Oakland County Megacast, talking to the ACLU about the prosecutor's race on this election eve, and then rounding out the show talking about strokes with Henry Ford West Bloomfield Hospital. But this is the Oakland County Megacast. We'll be back in just a few minutes.
Michigan, we still need to stay careful because we don't want to go backwards. Back to where we started. So keep standing 6 feet apart. Keep wearing a mask in public. And if you have symptoms, talk to a healthcare provider about getting tested. To move forward, let's all do our part. So stay careful. Michigan.gov/coronavirus. Michigan, we're calling on you to save lives. Don't ignore it. Don't let it go to voicemail. It's urgent. In fact, it's critical. Because if you've been in close contact with someone who tests positive for COVID-19, you may have been exposed to the virus. And you could get a call from My COVID Help or your local health department. So please answer the call to learn how to protect yourself, your family, and friends. We're calling on you to stop the spread of COVID-19, to make it safe to reopen businesses and help Michigan move forward. So if you get a call from My COVID Help or your local health department, you may have been exposed to someone with COVID-19. To protect us all, answer the call. Learn more at michigan.gov/contain-COVID. A message from the Michigan Department of Health and Human Services.
Thank you for tuning in to the Oakland County Megacast. I'm Ronnie Dahl here with Tyler Keith in the Civic Center TV studios. We say thank you for joining us for the Monday edition of the Megacast. As a reminder, you can catch us on Civic Center TV, Birmingham Area Municipal Access, Channel 15 Comcast, Channel 99 on AT&T. If you're out driving around in your car, you can also tune us into the radio, 89.3 Lakes FM, 88.1 FM, The Biff. And we also want to say thank you to the West Bloomfield Township Clerk's Office for being our Facebook friend of the day and allowing us to live stream today's edition of the Oakland County Megacast on their Facebook page. We are one day away. We are in the final countdown for this election. And while so many of us believe that it's been one of the most contentious and one of the most divisive elections that we've ever experienced, it's really not. If you go back in time and back in history, a lot of our elections prior to social media were pretty contentious as well. And to talk a little bit further about this topic, we're going to bring in Erin Dwyer. She is a professor of history over at Oakland University. Thank you for being with us.
Thank you for having me.
I just saw on Facebook someone posted a quote from Abraham Lincoln that says, "We are not enemies, but friends." And he had did that or released that quote, said that quote prior or just after the election because it was so contentious. Will we survive this?
Certainly, I believe I'm not psychic. I'm merely a history professor. But I do find comfort from looking to the past and seeing what our nation has endured in the past. And I don't see any exact corollaries, but we can see a lot of parallels that we can learn from and that can be instructive for us moving forward.
And with that, obviously, this is a different day and time. And with our technology and social media that we have now, it does spread the word so much quicker, along with disinformation. But what does looking to our past and to the history, what can it teach us about what we're going through right now?
You know, I think part of the question is who is doing the learning. So you bring up Abraham Lincoln, and I think he was uniquely suited to having been elected on the brink of secession. He's elected in November 1860, and within weeks, South Carolina had seceded. So when he was inaugurated, and at that time, the inauguration took place in March. So imagine an even longer stretch of waiting, an even longer lame duck period between American voters having their say in who should lead the country and that person getting to take over. And repeatedly, Lincoln really tried to be a president of union and of bringing the nation together. And when he ran for office again in 1864, he even would call himself the candidate of the party of union. So he didn't even play up the idea of the Republican Party. He repeatedly talked about, quote, the party of union. And so I think we can look to this idea of, you know, starting from the top, thinking about healing a nation, bringing a nation together, and seeing how at these moments of national crisis, or at these moments of a national crux, looking to leaders who are talking about bringing a nation together and being a leader for all Americans.
So there is hope for us going into this election for so many people that are stressed out about the election. I think I read one poll where stress about the upcoming election is weighing so heavily for so many people. but this isn't necessarily new, what we're going through, and we will come out of it on the other side.
Yes, but it deserves to be noted that if it feels like we are all dealing with an unprecedented amount of stress, it is because truly this is unprecedented. I think as a historian, especially in the early days of the pandemic, people kept saying, what is this like? Has there been a moment like this before? I even wrote to some of my grandparents, since we can't be visiting them right now, to say, have you ever lived through something like this before? What we see is essentially we are living through the 1918 pandemic, but with enough technology that we can be continuing to be having school remotely, going to work remotely. I'm obviously doing this interview remotely. And so that's a real dissonance that didn't exist in the 1918 pandemic. Then add to that, on top of it, the essentially the job loss numbers that we haven't seen since the Great Depression. And then add to that a really partisan political campaign and presidential election. So, it is not, to say that we will survive this election is not to say that this isn't an unprecedented, stressful time that we are living through, that historians really are struggling to find exact corollaries for, because it is so many different types of crisis concurrently, essentially.
Erin Dwyer with us here on the Oakland County Megacast. She is a Ph.D. and a professor of history from Oakland University. The presidential race of 1876, I'm from Ohio, and it was actually back in the area. The President Hayes was from Fremont. I'm from Tiffin. So, as a child growing up, we got to visit his house and things of that nature. That race is so fascinating. Even though it was 1876, there was no real clear winner. It took a long time, and we're hearing this presidential election that there may not be a winner for a while. There are parallels that are kind of happening here.
Yeah, that's a great one. And you're right, I will pause and say that, yes, the prevalence of technology makes us think that this is sort of that elections are football games that are decided the night of, and that's really a fairly modern phenomenon. When I'm reading 19th century diaries, it really is this stretch of time. I mean, when people are relying on railroads and telegraphs, it's an election night certainty about who has won is really a modern construct. But yeah, the 1876 election of Samuel Tilden was the Democratic candidate against Rutherford B. Hayes is getting a lot of attention these days because, exactly as you mentioned, it took so long to be determined, and it was really on the eve of the inauguration that the outcome was settled in a pretty decisive compromise. And the parallels that I see, some of it is about how long it took because there was essentially a tie in the Electoral College. And so the question was, how do you settle that compromise between the Democratic candidate, Samuel Tilden, who had won more of the popular vote, but how did they determine that a few swing states where it was divided, and so the Electoral College vote was undetermined. And so it was interesting too, because going into that election, we do see some more parallels with what we're seeing now. In the South, in particular, in the southern states in the 1870s, after the 15th Amendment had been passed, giving Black men the ability to vote, giving them the right to vote, there was still a serious voter disenfranchisement happening, primarily in southern states like South Carolina, like Louisiana, and like Florida, where the population was roughly 50%, if not 60% African American. And so there were concerns in those states about being outvoted. And so there were a lot of really anti-democratic attempts to be stealing the election, to be stealing votes, and to be intimidating voters through violence at the polls. A number of really, some of the most infamous riots, essentially mass lynchings that took place throughout the South, were in the early 1870s, trying to suppress the Black vote in these states, in states like Louisiana and South Carolina in particular. And so President Grant, who was in his second term, finishing his second term in 1876, he had frequently sent troops into the South to put down those riots, to try to say that his administration would support efforts to vote by Black people and wouldn't see them disenfranchised through essentially white supremacist violence. But there was a lot of resentment amongst white Southerners about that continued military presence, a military occupation of Reconstruction. And so what would then be compromised on the eve of the inauguration was that Rutherford B. Hayes, the Republican, would be given the win in the election. But in return, the occupation, as Southerners, white Southerners saw it, military Reconstruction would be ended. And with it, that meant ending federal support for trying to ensure that Black men were able to exercise their right to vote. So it's, in that election, I see not only parallels with voter intimidation and efforts to not count votes, I also see a lot of parallels with, is this compromise then selling out the vote of people? Was the, in getting Rutherford B. Hayes the presidency, was the choice to maintain power over really representing people who had elected, representing voters. So yeah, a lot of interesting parallels, and because Rutherford B. Hayes was given that presidency, and because then military occupation in the South was ended, Reconstruction was ended, it's only a few short years after that Southern states will start to implement Jim Crow laws that remove the black vote, remove the right of Black men to vote. And so really that election is so consequential because then Black men in the South would be unable to vote for really almost 90 years.
Dr. Dwyer, we're hearing stories as we get closer to tomorrow, to Election Day, and as we go into the process of tallying the votes and determining who will be our president for the next 4 years, so that people are going to the grocery stores, and some are starting to stock up and on food and other general items. We've heard reports that police departments are bracing for increased violence or potential rioting, regardless of the results of the 2020 election. Looking back to the mid to late 1800s, as we approach the Second Civil War, there seems to be a concern, particularly in social media, that we're at a similar point in our history. Are there actual parallels between the contentiousness of that time in our country and now, or are we just overblowing that with our social media landscape today, and really we're not even really close to that?
Yeah, I mean, I think it's hard to say. I think social media is really still a new enough phenomenon for how it can amplify a bit of an echo chamber, that people can have a bubbled perspective that is being mirrored back at them. So I think that can be a misleading place to get prognostications about our future. I think the other place where the parallel starts to get a little tricky is that when secession began, when South Carolina is the first to secede after Lincoln's election, and really as a direct result of his election, South Carolina secedes, and it's followed by other states in the Deep South. But what we see today that's much more complicated, I think the kind of election map, football game, red state, blue state, belies the fact that our states are incredibly mixed. I mean, we know this to be true of Michigan, which is a swing state. Before I moved to Detroit, I lived in New Orleans, a blue pocket in a red state. And so it's a lot more complicated to talk about a physical separation of sort of civil war. Now, are we potentially going to witness more an uptick in white supremacist violence in particular? Well, yes, the FBI has been warning about that for years. The FBI for years has been saying that they're seeing a rise in right-wing, white supremacist violence. I mean, we saw that in our own state alone with efforts to kidnap Governor Gretchen Whitmer. So, but do I see that leading to a physical secession? Let's just say that in all of the history of the United States, secession has never gone well for secessionists. Not the least of which, because when we think about how federal funding to states works, that is the least likely scenario in my view.
It's fascinating to look at history and to see things were so different. They were documented much differently than what we're documenting them today, which also makes you wonder, back in the day when typically it was the white male who was able to read and write, and therefore a lot of our history is coming through their eyes. But today we're able to document history in so many different forms and so many different ways. When you're studying history, does that play into some of your thought process as to who was actually documenting the history?
Yeah, I love that question. And because I write in particular, most of my research is on the history of slavery, so I'm confronted with very limited source base. There are perhaps 200 book-length slave narratives when, at the end of the Civil War alone, roughly 4 million people were enslaved. So that's really a drop in the bucket. But then historians of the 21st century will have the opposite problem, because historians 20, 30, 40 years from now, they'll be looking at our tweets, they'll be looking at Facebook, they'll be looking at Instagram, and think about the volume that then will exist of sources. So it's a different problem for a different source base. But I would encourage, when I have been stressed as a parent, as a working parent, about a pandemic and raising a child in pandemic, I do think about telling my daughter about this 10 years from now, because it's inherently imagining a future in which this pandemic, this stress about the 2020 election, it's imagining a future in which that's not happening anymore. And so I think the other ingredient to this is, because of quarantine, because of social distancing, there is less support for us all to be talking through some of the collective trauma we are experiencing as a nation, undergoing this really unprecedented death toll from COVID, a very different type of death, the distancing that we're all experiencing from one another, uncertainty about jobs, uncertainty about politics. And so, the historian in me says, start journaling if you aren't already, write about what you're experiencing. Those sorts of sources will be interesting to historians in the future, and I think it's a way to be working through, outside of the echo chamber of social media, this really unique historic moment in which we find ourselves.
Quickly, before we let you go, just another minute or two with you, let's talk about Thanksgiving. Thanksgiving is right around the corner, and I didn't realize that Thanksgiving was born out of a way to unite the country.
Yeah, I really love that idea about creating a holiday to unite a nation. So it was in November of 1863, so roughly 9 months after passing the Emancipation Proclamation, and just a few months after the Battle of Gettysburg. And so acknowledging a lengthy war, a really high death toll, Lincoln wanted to make a national holiday. So he has this proclamation that I'm assigning to students for the first time this semester, where he talked about the idea of creating this holiday, trying to unite the nation, and trying to unite the nation in gratitude, to stop and take stock of all the things the nation should be grateful for. So one of the lines from it is, quote, "It has seemed to me fit and proper that we should be solemnly, reverently, and gratefully acknowledged with one heart and one voice by the whole American people." And so the idea was to create this holiday that could be a day of thankfulness and a day of uniting the nation amidst this national crisis. So, of course, at the time, he's only the president of the North. It would take, I believe it's the 1930s before FDR would make it a national holiday for the nation and establish it on the particular Thursday in November. But it was Lincoln thinking about, going back to that idea I mentioned before, that he wanted to be the party of union, and he's thinking about knitting the nation back together with a holiday where people stopped and took stock of what they were grateful for.
That is a great reminder for all of us and a good place to wrap up the conversation. Thank you so much for being with us. And as a history professor and a lover of history, this time must really excite you because there's a lot to document, and you wonder how it's going to play out for generations to come. Like in 100 years, how are they going to be viewing the time that we're living through right now?
Yes, may we all live long enough to be reading those history books.
Well, thank you so much. We appreciate your time as well as your insight here with us on the Oakland County Megacast. Tyler and I are going to take a quick break, and then when we come back, Michigan Women Forward. We'll be speaking with them and all of the great work that they are doing, even during the pandemic.
Hi, my name is Kurt Lawson, and I'm the Public Information Officer for West Bloomfield Township. We wanted to reach out to you, our older adults, to provide information that you may find useful during this difficult time. We want to ensure you that West Bloomfield Town Hall, our Waters and Utility Department, West Bloomfield Parks, and our police and fire departments continue to work hard on your behalf. Information and resources can be found on the Township website, the police Facebook and Twitter, or call West Bloomfield Park's COVID-19 Help Hotline. Please remember to keep your social distance of at least 6 feet, wear facial coverings when you leave your home, and wash your hands for at least 20 seconds with soap. These precautions will help keep you safe during these difficult times.
This may seem uncomfortable, but so is being hooked to an IV, sleeping in a hospital bed, and fighting for your life. When it comes to COVID-19, comfort is not as important as saving lives. Wearing a mask can greatly reduce the chance of spreading the virus. So mask up, Michigan, every time you leave home.
Thank you for tuning in to the Monday edition of the Oakland County Megacast on this election eve. Great to have you with us, and we want to say thank you to the West Bloomfield Township Clerk's Office for allowing us to Facebook stream this live on their Facebook page today. They have been working incredibly hard around the clock to get prepared for the big election, so we want to say thank you to all that they are doing as well. Shifting just a little bit, but we were talking about history, and there have been so many women within our history that have done amazing things for our country as well as for the state of Michigan. And there is an organization here, I think a lot of people don't realize that they exist right here in our backyard, and they are working to not only document all the amazing things and contributions that women have made to the state of Michigan, but also to help women move forward and to continue to support them in their endeavors. We are going to be joined right now with Meaghan Berman. She's the program manager for Michigan Women Forward. Thank you so much for being with us. It's great to have you with us on the Oakland County Megacast.
Thanks for having me.
For those not familiar with your organization, give us an update as to all that you do.
Yeah, so Michigan Women Forward is a community development organization whose mission is to expand economic opportunity, empower the next generation of women leaders, and celebrate and honor the accomplishments of Michigan women. So we have 4 pillars, and each pillar has its own way of addressing the needs of Michigan women.
How did this organization even get started?
So Michigan Women Forward has been around for over 30 years. And it started as a foundation. We used to be Michigan Women's Foundation that, really encouraged philanthropy. And we've moved forward, if you will. And so now we have, like I said, 4 different pillars, an entrepreneurship pillar, a women's history pillar with Michigan Women's Historical Center and Hall of Fame, our UGoGirls pillar, which runs camps and other programs that empower our next generation of women leaders. And we have a Behind Every Woman pillar, which provides resources and funding for social justice issues, like the Rape Kit Initiative we did a few years back.
So many different areas to focus on because the need is so great, and yet we're in the middle of a pandemic. So many organizations have been directly impacted. How is your organization doing, and how are you able to get donations and get out and spread the word about your organization during this time?
Yeah, that's a great question. And we have pivoted. Every other organization and nonprofits especially. And one thing we're really proud of is our partnerships with our donors. We've had long-standing partnerships, and they continue to support us through thick and thin. And without them, we would not be here. Like DTE supported us with the Hall of Fame event this year, the 37th annual Michigan Women's Hall of Fame induction ceremony. We partnered with MEDC to provide this Michigan Women's Entrepreneurship Resilience Fund through the pandemic to make sure that Michigan women and minority-owned businesses have the resources and funding to stay open. And just, there's so many other examples of the way donors and partners have helped us as an organization stay alive, but also have helped Michigan women and minority-owned businesses stay alive. And we are so grateful.
Yeah, right now, too, in the middle of this crisis, so many businesses are struggling. So how are some of these women doing that have been trying to start up or operate a small business during the middle of this time?
Yeah, so through our Resilience Fund, we gave out 154 grants, equaling almost $700,000. And we gave out 44 loans, over $350,000 in loans. And it was a month-long process. We started this back in April, and women-owned businesses and minority-owned businesses could apply for these grants and loans as long as they determined, or they showed that they were going to put this funding towards pivoting during this the pandemic. And these organizations, these businesses rather, have been able to use this money to get the PPE or put up glass walls just to keep their businesses open through this, and to pay their employees, keep everybody on. So we're really proud of this project.
Meaghan Berman with us. She is the program manager with the Michigan Women Forward, joining us today on the Oakland County Megacast. And Meaghan, as you continue to support women in a variety of different capacities in our society today, how important with your leadership programs is it to foster a similar mindset and a similar determination in the next generation of women coming up, who are not only going to be the leaders in our society for years to come, but are witnessing this surge in empowerment of women in our society and due recognition finally for women in our society that are doing amazing things in all different sectors? How important is fostering leadership in that next generation at this time, given what we have going on in our world?
Well, in my opinion, it's the most important thing we should be doing right now. We could be doing right now. And the thing is these young women, these, middle school, high school girls, they are craving programs like this. It's them that are asking for these leadership and empowerment opportunities. And, this summer, typically our programs are in-person camps hosted at different universities across the state. However, this year we pivoted and went virtual. And it was amazing. We had over 50 girls in our virtual visionaries program, which was a 4-week program. And we had over 40 girls in our STEAM, our virtual STEAM program, which we partnered with Motor City STEAM in Detroit to facilitate that. And, I'm actually planning a virtual visionaries reunion for the end of November because the girls are just so eager to continue this network, to continue learning and about leadership and empowering themselves and each other. And it's, they are motivated. It is them. It's, we are just here providing the resources and providing the space. But it's them that are, asking for these resources and these spaces to exist. So,
how old are the girls? And if I'm a parent and I'm listening to this for the first time, can they get their child involved as well?
Oh yeah, absolutely. So our virtual STEAM program, and in the past, our in-person STEAM or STEM program, science, technology, engineering, arts, and math, are for middle schoolers. So if they are entering 6th through 8th grade in the fall. Our virtual visionaries program, which was our girls on campus program, is for high school girls, so 9th through 12th graders. And if you are interested in applying for next summer's programs, you can go to our website, miwf.org, and learn more about those programs and get in contact with me and apply.
What are some of the changes you've seen of some of the girls that have gone through the program?
Oh, wow. Well, for example, 2 of the girls that I worked with in virtual visionaries, one is a sophomore and one is a junior. They just started their own club at their school that was prompted by what they learned in virtual visionaries. And I am helping them kind of get that club off the ground. We just had a meeting last week to talk about how they were going to market this club and how they were going to get local businesses involved, how they were going to find women mentors to get involved in this club. I mean, it was one of those moments where you realize, yes, this is exactly why I do what I do. We really encourage, higher education. We encourage financial literacy. And you see these things as we keep in touch with these girls over the years. You see how the tools and the things they're learning in these programs extend out into the rest of their lives. So it's just exciting.
Oh, it's great as they're learning these lessons at a young age, and then they can carry them with them for years to come. So that is so great what you're doing. Can we talk a little bit about the Michigan Women's Historical Center and the Hall of Fame? I think a lot of people don't even know that this exists.
Yeah. No, I know. So, and which is such a shame because the Michigan Women's Historical Center and Hall of Fame, it was created in 1983. And it was created by the Michigan Women's Studies Association at Michigan State University. It was the first of its kind in the nation. So it was the first first Women's Hall of Fame and Historical Center, state-based in the nation. There are several other states who now have their own Women's Hall of Fame and historical centers, but we were the first. And we've been around for 37 years. And in 2018, Michigan Women Forward, they assumed responsibility for the Hall of Fame and Historical Center We moved it, the actual physical museum, back downtown Lansing. So we are a block in front of the Capitol in Lansing now. And, you know, we've got a really cool suffrage exhibit to commemorate the 100th anniversary of the ratification of the 19th Amendment. We've got a Civil and Voting Rights Act exhibit, which I think is extremely, you know, relevant, especially this year. And we have the Digital Hall of Fame exhibit, so you can see and learn about all 333 Michigan women who have been inducted to the Hall of Fame.
And is the museum open for visitors right now?
So it is, but by appointment only. And again, you can go to our website, miwf.org, and you can schedule a tour with me. And we are only allowing 7 or less people for tours at this time because it is kind of a smaller space. Masks are required, of course. And I would love to, you know, give anybody a tour who's willing to come on up to Lansing.
It's so great that this even exists here in our backyard. Meaghan Bergman with us. She's the program manager, Michigan Women Forward. Meaghan, before we let you go, anything we didn't touch on that you maybe want to share with our listeners and viewers?
I do want to, you know, help people understand that Michigan Women Forward has so many different avenues of getting involved and being able to support Michigan women. So go to our website, miwf.org. If you are a small business looking for financial support, you know, we have a microloan fund program and we would be happy to talk with you. If you are a mother or a father and you know, want to get your daughters involved in a leadership and empowerment program with girls all around the state, come and seek us out. We would love to meet your kids. And if you are a history buff and would love to learn about the impacts of Michigan women in our state, then come on down to the museum in Lansing.
Thank you so much for taking time out of your schedule to be with us here on the Oakland County Megacast. Great speaking with you, and we learned so much. Thank you so much.
Thank you, guys. Have a great day.
You too. We're going to take a quick break here on the Oakland County Megacast. Still a lot to get to in the next hour.
As rivals, we don't always see eye to eye.
Like who scored the best recruits?
Who's gonna be who?
And whether we wear green
or blue.
But one thing we can all agree on, to help stop the spread of COVID-19, wear a mask.
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 The ball's in your court, Michigan. As rivals, we don't always see eye to eye.
Like who scored the best recruits?
Who's gonna be who?
And whether we wear green
or blue.
But one thing we can all agree on, to help stop the spread of COVID-19, wear a mask.
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 The ball's in your court, Michigan.
Thank you for tuning in to the second hour of the Oakland County Megacast. I'm Ronnie Dahl here in the studios alongside Mr. Tyler Keefe, Civic Center TV, Birmingham Area Municipal Access. You can also catch us on Channel 15 on Comcast, Channel 99 on AT&T. If you're out driving around, tune in to 89.3 Lakes FM or 88.1 FM The Biff. Tyler and I are here in the studios Monday through Friday, 10 a.m. to noon, to bring you the latest information with all things COVID-19 related. And we saw the headline coming into the studio today. West Bloomfield School District is now switching its learning plan due to the surge in cases. We're going to bring in our good friend Deanna Barash. She's the Assistant Superintendent of Curriculum Assessment and Instruction for the school district. Always great having you on the show. Thank you for being with us.
No problem. Thanks for having me again. I feel like it's been just a couple weeks and I'm back. So.
I know, and it's because everything changes so quickly, which has to make your job nearly impossible.
It is. It is never a dull moment, and certainly it requires us always to be monitoring the data and in constant communication, and obviously be willing to switch at the last minute if need be, which is what we had to do this weekend.
How do you come up with that decision? So it's going to go back to all remote learning for right now, and how long is that going to last?
So it starts effective today through Friday, November the 27th. And as long as the data suggests that it's safe to come back, we'll be back for in-person instruction on Monday, November the 30th.
What goes into making those decisions?
We were notified late Friday, early Saturday that Oakland County, who has developed their own matrix actually, and it's called the Oakland County Guidance for In-Person Instruction. And it is really a letter grade system, obviously good enough for us, right? So easy to understand, letters A through E, which shows the level of exposure, the level of risk, and then gives guidance about what schools should do based upon the level of active cases and infection rate across the county, and what we should consider. Over the weekend, we were notified that Oakland County has moved to level E, which is the highest level of risk that you possibly can have. So you have transmission, you have high infection rate, and so schools, based upon those factors, as well as what we're seeing in our own schools at this time, need to transition to fully remote learning. And so we made the decision really Saturday morning. We had conversation as a leadership team. We talked with our principals yesterday, and then let our staff and parents know this morning that we were transitioning to remote learning for the next month.
And I know that these decisions are never easy for you and the leadership team to make. However, to wake up today, I'm just imagining if I was a parent and then I wake up today and it's like, oh no, you have to be remote. I worry about the change in the schedule, the change in worrying about childcare. And I'm sure that those concerns were taken into consideration when you made these decisions. So how are you explaining this to the parents out there?
So we encourage our parents. We're actually going to do a webinar this evening at 7:30. The link is on our website and all over social media. So we'll go into a little more detail for our parents this evening, help them understand the transition and what the schedule is going to look like for the next month and so forth. So we encourage our parents and community members to tune in at 7:30 tonight. The webinar link is on our website so they can get some more information. We know it's difficult, and I think it's an understatement to say that these decisions are never easy, and I don't think I want anyone to believe that we take them lightly and that we don't take all those factors you mentioned into consideration. The bottom line is that we have active cases in a number of our buildings. We have a significant number of staff and students already in quarantine, not from exposure at school, but certainly from things occurring outside of the school day. So whether that's events that they participate on their own time, family exposure, parents who have tested positive, grandma and grandpa have tested positive, athletic teams, you name it. We're seeing a number of staff and students who are already in quarantine. And so when you couple that with the significant rise in Oakland County of cases and knowing that we're not anticipating a decrease anytime soon, we need to make sure it is our duty to keep our students and our staff safe. And so we need to make sure that we do that by limiting the amount of opportunity for transmission from student to student and parents and staff. And so that means going remote learning only. It is not an easy decision. We know parents are frustrated. We understand. We really do understand. It is heartbreaking for all of us to be back in this situation again. But we also need to know that we have to keep the health and safety of our students and staff first and foremost. And when you're seeing the number of cases that we're seeing students who are testing positive from lower elementary age students and middle schoolers. We already have our high school fully remote. We have staff members who have tested positive. We have to make sure that we don't continue the spread. And the sooner we can contain that and we do what we need to do, the better our chances are to return to normal in-person instruction. And so sometimes we have to take those drastic measures in order to get back to some sense of normalcy.
So, Deanna, what's this look like for the teachers? Are they remote as well, or are they actually teaching from their classrooms in the building?
They're going fully remote as well. So today they're planning. They're getting material pickup ready, materials for students that they can pick up on Wednesday, contactless pickup. So families will be hearing about that very, very shortly. But the buildings will be open for our staff to kind of finish up through the end of the day Wednesday, and then everyone will be working remotely until November the 27th. We want people at home. We want teachers teaching safely from home. We want to do everything we can to mitigate the spread. So that includes West Bloomfield High School teachers who have been in person in the classroom teaching since the start of school. They will be moving to fully remote teaching from home as well.
Deanna Barish with us. She's the Assistant Superintendent for Curriculum Assessment and Instruction at the West Bloomfield School District with us on the Oakland County Megacast. And Deanna, with school now being all virtual until at least November 30th, by then you're into the later portion of the semesters. We're approaching the holidays. How does what's going on now and the status of it being entirely virtual through the end of the semester, albeit not knowing what the future holds with COVID-19 and the response to it and the number of cases or the positivity rate months out, how does this current situation inform the district's plans for next semester and going forward with this school year?
Well, last week we held a parent webinar and actually had sent a parent survey to be completed about what our next step should be. So what has gone well this fall? What should we consider as we think about our next steps and our return to learn? And at that point in time, we were thinking about what does it look like if we were to start to bring cohorts of students back in together? How can we safely bring West Bloomfield High School students back into the building? And so certainly this move to remote learning only will impact those decisions. And so we will continue to engage our community as we have from the very beginning. We'll continue to plan on what that's going to look like when we can safely bring students back into school. And certainly we'll continue to communicate that to everyone as well. We are in such a tough situation. And I know everyone says it all the time, and I know it sounds very cliche. It really and truly is a no-win. No matter what we do, it is difficult. We want kids back in school. We do. And we want high school students there. We want elementary students there. We know that our teachers are struggling because they too need each other and need to be able to see their students every day. But we have to think about what's best in the safety for our students and staff. And so we don't have a crystal ball. None of us do, to predict what may happen in the next month. And certainly, as we move into the holiday season, where there are more opportunity for students and parents to interact and people are out in the community, we know there's COVID fatigue. We know that's a real thing. You see, not so much at school, but certainly out in the community, you see less mask use, you see less social distancing, you see all those things that impact the transmission of COVID. And so we have to, while we can't control what people do outside of the school day and outside of our buildings, we need to be able to control what we can within our schools. And at this point in time, the safest thing we can do in order to contain that and the hopes that we can get back to normal school is to make sure that we are learning remotely and that we mitigate it as much as possible. I don't know, Tyler, what's going to happen in the next month or so. We will not wait. If there needs to be a change, if there should need to be, for some reason, an extension of remote learning, we won't wait until the Friday before to make that decision. We'll be monitoring the data. Parents, we have a COVID link on our website now, so parents are able to see our data, so the number of positive cases that we have in the district that is updated every single day. We've been sending emails to our families every day, district-wide, regardless of the building that your children attend, letting our families know where we have cases and what the protocol has been, and we've been in constant communication with the health department. That we continue to update the website as well with the county data, so parents can get on, they can look at our zip codes, they can see the infection rate, they can see the transmission rate, and we also have a link to the matrix that I referenced, which is the Oakland County kind of guidance for in-person learning, and they can see that we are at level E, and what that means, which is that we needed to move to remote learning. We'll continue to monitor all that data, we'll be in contact with the health department, and we'll make the decisions as that data becomes available.
Deanna, I believe that the school buildings are going to be closed to the public. How does this decision impact the students that play sports?
right now we're continuing. MHSAA has not made any decision about winter sports. At this point in time, MHSAA is saying that winter sports will continue as usual. We hope that maybe they begin to think about at least postponing the start of the winter sports season for a period of time, knowing that now we're moving indoors. There's the difference between those outdoor sports like football and cross country and soccer and lacrosse and those sorts of things versus moving everything inside like basketball and wrestling and hockey and those events. So right now we have some time. Those sports -1 really don't start until next week. So we're hoping to get some guidance from MHSAA this week. We know that there's some conversation that probably will be taking place about those as well. At this point in time, football is scheduled to continue to play and to practice again because they're outside. We are going to make sure that we are cohorting and following all of our safety procedures for our high school sports that are still in season. There are very few left this fall. We're just going to try to get those finished out and then wait for some guidance from MHSAA about the winter sports season.
Deanna Barish with us, Assistant Superintendent for Curriculum Assessment and Instruction, joining us on the Oakland County Megacast. Deanna, the last time the school district had to go entirely virtual, one of the first things that was put into operation was ensuring that those kids that are receiving free or reduced price lunch were still continuing to receive those meals. Is a similar operation going to be intact at this point in time with school returning to remote, and how is that planning to be enacted, if at all, safely given the current circumstances with COVID?
So actually, we started the school year. We haven't served lunch in person or breakfast all year long, simply because that would mean students would be without their masks and more risk for exposure. So families have had the opportunity to go to West Bloomfield High School to pick up food, as well as to Roosevelt to pick up food. That will continue. So the same process we've used really since the summer, and then for sure since the start of school in August, will continue in the coming months. So they actually pick up multiple days worth of food twice a week, and that will continue as normal. So we'll make sure that our families and students continue to have food.
Again, we know that this is an impossible position for you and the leadership team to be in over at the West Bloomfield School District. Also an impossible situation for the parents and the students as well. I worry about some of the students and their mental health during this time, and I know that the school district has tried to address that. Are you seeing an increased need for students with their mental health?
I would say yes. I mean, I think that we know that it's been tough. I think it's hard on families. It's hard on the adults too. And so we've had our counseling staff, our social workers. We have a school mental health specialist who we hired last spring, prior to COVID actually, working in the district, as well as our restorative practice team. So we've put measures in place. We actually did some training this fall that helped people identify students at risk and not just harm to themselves, but potentially harm to others, and just kind of really being aware of what those signs might be and how we're going to intervene when needed in those situations. And so our teachers know our kids. I think one of the benefits that we have to remember, and one of the things we shared with staff this morning, we've been back in school since August 25th. We've been able to have a full quarter, 25% of the school year, we were able to follow our plan without interruption. So our teachers who have kids in person have already established those relationships. Those students feel like they know their teachers and vice versa, and that will make this for a successful transition. I think something else we have to remember, all of West Bloomfield High School has been remote the entire school year, has been remote since March. We have 1,500 students in Lakers Online, kindergarten through 12th grade. They've been fully remote since the start of the school year. And while we have had students in person, K through 8, 50% of their schedule has been remote learning. So our students probably will transition fairly well to this. We know it's going to be tough because they've gone 4 mornings a week or 4 afternoons a week for in-person instruction. And so that is going to be tough, and it's going to be an adjustment. But they've been online. They've been interacting with their teachers virtually. And the vast majority, more than 50% of our district, has been remote learning only since the start of the school year. And so while it certainly is an adjustment, we have all those plans in place. It will be seamless. We'll be able to we have established relationships with our kids, and learning will continue, even though it won't be in person.
Deanna, prior to the pandemic, back when life was somewhat normal, one of the big discussions within schools had to do around bullying. And obviously the focus has shifted now for, important reasons. But is there still a conversation being had about bullying? Because I was speaking with a parent this past weekend, and it seems like bullying has kind of switched to a degree, because now with everything being remote, it seems like some of these kids have more access, or not even necessarily more access, but more time for other things to happen. And are you seeing an increase in the bullying complaints at all, or is it even possible for people within the school district to know, because everything is so remote?
Well, I guess it's a good public service message to remind our students as well. We've had a couple incidents, of course, where students have posted things in the chat on Zoom. All of that is archived. And so anything that is said in a chat is recorded and is something that we can access. We obviously had an issue at the beginning of the year where we had people who were not authenticated users who were coming into our Zooms and being disruptive, and that has stopped since we've required authentication, so that's been a good thing. We continue to encourage our students to be obviously good people and to make good decisions, and also to remind them that we can see what they're doing. So whether or not that's even they're using our school issued Chromebooks at home and we're able to see what sites they're accessing, we're able to see who they've interacted with. There is a little sense of Big Brother with our Chromebooks because they are on our network, and so they have to be very careful and understand they should be making good decisions. They shouldn't be treating each other poorly anyway, but they should know that we're able to see what they're doing. We've had a couple instances this year where things have been posted, not very kind things about other students or about teachers in the chat on Zoom. It is archived, we're able to see it, and then our administrators follow up on those kinds of things. So we want to make sure that obviously if parents see that or hear about it, they're reporting it to the teachers, they're reporting it to the administrators, and we'll take care of it. The school code of conduct is still in play, no differently than if we were in-person instruction. And obviously we encourage that our students, if it's happening to them or to their friends or they witness it, that they tell an adult so that we can deal with it. The last thing we need at this point in time, when everything is so stressful and people are really struggling to begin with, is to not treat each other kindly. And so whether that's adults or students, quite honestly. And so we need to make sure that if it is happening, that we are aware of it so that we can handle it.
Good words to leave on. We so appreciate you taking time at the last minute out of your schedule to help us get this word out, but also to let people know the reasoning behind the decision, because it's never an easy one to make. So thank you so much. We appreciate it.
Thank you for having me.
We're going to take a quick break here on the Oakland County Megacast. Tyler and I will be right back.
Hi, I'm Dr. Faust, the Medical Director for the Oakland County Health Division. The most important thing you can do to prevent the spread of illness is to wash your hands thoroughly and often. Follow these 6 easy steps every time you wash your hands. Step 1, turn on the sink and wet your hands with warm water. Step 2, apply soap to your hands and lather between your fingers, under your nails, and the front and back of your hands and wrists. Step 3, wash your hands by scrubbing them together for at least 20 seconds. Step 4, rinse your hands with warm, clean water. And step 5, dry your hands with a clean cloth towel, a paper towel, or hot air blow dryer. If you're using a cloth towel, make sure to change it often. For handheld faucets, turn off the water using a paper towel instead of your bare hand. Step 6, if you're using a paper towel, throw it away. Practice healthy habits like washing your hands after coughing or sneezing into them to keep you and others healthy. Go to oakgov.com/health or call Nurse on Call at 1-800-848-5533 to learn more.
Michigan, the coronavirus pandemic has put us all to the test. And now it's time to put COVID-19 to the test. As we move forward, testing will be critical. We encourage anyone who has reason to get tested to do so, those with symptoms and those without. If you are leaving home and going back to work, get tested. If you think you may have COVID-19 or you've been exposed recently through family, friends, or coworkers, get tested. Our test locator tool can help you find the right testing site that fits your needs. Even if you're looking for easy access with no cost, no prescription, and no appointment necessary, we've got you covered. Help Michigan move forward, not backward. To find a testing site or learn more, visit michigan.gov/coronavirus-test. A message from the Michigan Department of Health and Human Services.
It is election eve.
Oh boy.
Oh, the time has come. Just hours left into this campaign, and we will be able to turn a corner and move on to the next one. It's never ending.
Yeah.
However, one of the things, there's so much focus on the presidency. I'm really hoping people are taking the time to focus on what's also happening here locally in our own backyards. Because if one thing, and if anything has happened during this pandemic, it has taught us just how important the people that we elect to represent us and put us in these positions, I don't care if it's from the school board to, the Senate, to your, your prosecutor, they all have such a direct impact on us here locally. So let's hope that this election, when people go in to vote, for those that are still going to be voting that haven't done so already, they've done their homework. And with that, the ACLU this year launched a program to focus on prosecutors. And Jessica Ayoub is with us right now on the Oakland County Megacast. She's the public engagement strategist for the ACLU. Why focus on the prosecutors, Jessica?
Yeah, that is a great question. So obviously, as you mentioned, there is a huge election tomorrow, but also up for election is county prosecuting attorney, not just in Oakland County, but actually statewide prosecutors are up for election. And prosecuting attorneys are locally elected officials who are the most influential player in the criminal legal system. Your prosecuting attorney decides who to charge, what to charge, and ultimately how many folks sit behind bars in your community. And they have more power and opportunity than any other elected official to end this cycle of mass incarceration that Michigan is facing.
So we should say ACLU is a nonpartisan group. However,
Absolutely.
You have taken on this mission. Why is it important to recognize what's going on in our legal system, and what do you and the others within your organization want to see change?
Yeah, that's a great question. So prosecuting attorneys is an important race for all of the reasons I just mentioned. And as a nonpartisan organization, we certainly won't support or endorse a candidate. But what we want to do is really uncover the role of a prosecuting attorney. Too many voters don't know, one, that their prosecuting attorneys are elected, and two, that their prosecuting attorneys have a lot of influence over what happens in their courtroom, or in the courtroom and in the criminal legal system in general. So here in Michigan, we are facing an incarceration crisis. The number of folks who are incarcerated is climbing. We're seeing huge racial disparities in terms of who is incarcerated in the state, but also in Oakland County. And so what we want to ask of prosecutors is that they make a pledge to reduce the number of people who are incarcerated in their county, tackle the racial disparities that they're seeing in the criminal legal system, and overall increase the transparency of what happens in their office, really uncovering their charging decisions, who accepts a plea deal, who gets offered a plea deal, who is charged with certain crimes and why they're charged with those crimes, so that the public can see how these elected officials are fulfilling their campaign pledges, and the public can decide if these elected officials are representing them.
Yeah, because so many times it does seem like they're operating behind a veil of secrecy. We are privy to those decisions, but not how they came to those decisions so many times. Jessica Ayoub with us here on the Oakland County Megacast. She's the Public Engagement Strategist with the ACLU. One of the things, any focus on the judges as well, because judges have a lot of power within the courtroom. But I know when I've tried to do my research, when it comes to the election, and you're trying to do your research on the judges, there's not a lot of information out there that's available for people to be able to get their hands on.
Yeah, one of the biggest things that we've been focusing on this election cycle is actually getting voters to realize that they do have to vote for judges because they're in the nonpartisan section of the ballot. What we're seeing is a lot of folks don't realize that if they're voting straight party or if they're voting for individual candidates, they actually have to fill out their full ballot to vote for judges. So right now we are just increasing attention on that nonpartisan section of the ballot to make sure voters know to fill it out, and that they have a say in those folks and who sits on the benches here in Michigan.
Yeah, and while the judges are nonpartisan, many times they are also appointed or pushed behind one party or the other. So people should know that to do a little bit of homework to know before you go in, because obviously this year the Michigan State Supreme Court is a huge, hotly contested office or election this year, especially coming out of the decision following the governor's executive orders. So there's a big push to get some of the Democratic preferences, let's just say that, preferences elected to that position as well. One of the things, Macomb County, a big switch there after Eric Smith was indicted. So that's a shakeup in Macomb County. But one of the things I would say, and I invite people to do, is go through their campaign finance reports. I think a lot of people don't realize that information is available to the public.
Absolutely. That's a really great point. And, as we mentioned, our goal really is increasing transparency of these prosecuting attorneys and their offices and their plans for their office. And so in service of that, in June of this year, we sent a candidate survey to all candidates for prosecuting attorney across the state and gathered their responses. And you can see how they responded to our candidate survey at smartjusticemi.org.
And do you think when they're filling out those surveys, are they actually being honest, or are they putting what they know organizations such as yours wants to hear?
So I think they're being honest, but the beauty of the ACLU is that we don't exist just in election cycles. And so we've got these responses, we've got these commitments from candidates, and depending how things turn out tomorrow, we will be there to hold candidates accountable to what they promised and make sure that they are representing what their community demanded.
One of the things that we are seeing during the COVID crisis, some of the jails as well as the prisons are releasing nonviolent prisoners or others to try to address the overcrowding that's happened in some of our jails and prisons. Do you think what they've learned from this crisis can stay after the pandemic, if we ever get to that point?
Absolutely. What we're seeing now is that we're able to release folks from jail who are not posing a threat to their community, and that is a practice that should stay well after the pandemic. Folks should not be incarcerated because they can't afford bail. They should not be incarcerated during a public health crisis, right? When we know that jails are overcrowded. And so what we're seeing is that reducing our jail population is possible, and keeping our communities safe while doing that is possible.
Yeah, because I mean, obviously no judge wants to be the person who released someone and then they go out and they recommit a violent crime, because that could be a detriment to the community. but also to the judge or prosecutor's career. But on the other side, they don't have a crystal ball to know who is going to reoffend and who isn't.
Yeah, I mean, if we're looking particularly at folks who are incarcerated in jail right now, about 60% of the folks who are in jail here in Michigan have not been convicted of a crime. So these are folks who have been charged with something, but they've not yet been convicted. And what we're seeing is that these folks are staying incarcerated because they can't afford to post their bail. And when they can't afford to post their bail, they're at a greater risk for losing their job, losing their housing, being separated from their family, potentially losing custody of their kids. And there are all of these collateral consequences that we're seeing individuals who get entangled with the criminal legal system, really being up against when we know that there's a better way. And, the fact that we've been able to release so many folks during the pandemic just shows that there is a better way.
One of the things when we're looking at that, is this part of an overall plan or structure to try to reevaluate our bail system in America?
Yeah, absolutely. So the ACLU of Michigan has been embarking on a campaign called the Campaign for Smart Justice for about 3 years now. And the goals of that campaign are to cut mass incarceration in half in Michigan and to challenge the racism that we see in the criminal legal system. And right now, one of the hallmarks of that campaign is reforming Michigan's pretrial system. The governor appointed a pretrial task force about a year ago, and they released a series of comprehensive recommendations on what could happen to reform Michigan's pretrial system. And so our Campaign for Smart Justice is really focused on working with the state legislature to implement those reforms as comprehensively and as meaningfully as possible so that we can start seeing some of these reductions in incarceration here in Michigan.
Jessica Ayoub with us here on the Oakland County Megacast. She's the Public Engagement Strategist with the ACLU. Jessica, just a couple more minutes with you before we let you go. Anything else going on with the ACLU and the work that you and your team are doing here in the state of Michigan that you want the viewers and listeners to know?
Yeah, it would be remiss of me to not remind folks that there is a huge election tomorrow, and it is critically important that voters' voices are heard. And so we want folks to make sure that they've got a plan to vote. Polls will be open from 7 a.m. to 8 p.m. tomorrow. And if anyone has any issues at the polls or just questions about their voting rights, we want them to give us a call at 866-OUR-VOTE. That's 866-OUR-VOTE. And we would love to walk folks through any challenges they're experiencing. But, we're looking forward to seeing really incredible turnout tomorrow.
I think we've already seen an incredible turnout, and the polls haven't even voted. People are definitely taking advantage of voting absentee this year. Hey, quickly before we let you go, when it comes to so many of the prisoners or people that are locked up right now, have you been hearing directly from them and their family members about what they're going through behind bars in some of the jails and prisons? Because obviously a lot of times we do have people on from the Department of Corrections, but you're getting the spin. What are you hearing from the people that are actually locked up behind bars right now?
Yeah, so we have been hearing from folks who are incarcerated throughout the pandemic just about some really not great conditions. There have been reports of folks not having enough proper sanitizing equipment, the fact that it's nearly impossible to quarantine or self-quarantine or social distance even while folks are incarcerated. And so what we're seeing, what we're hearing from the inside is that it's nearly impossible to follow the CDC guidelines for combating COVID-19. And so we've got our legal team is hard at work working to make sure that folks' rights are not being violated while they're incarcerated.
Jessica Ayoub with us on the Oakland County Megacast. She's the public engagement strategist with the American Civil Liberties Union, the ACLU, joining us on the program today. And Jessica, just another couple of minutes with you before we will say goodbye today. Is there anything else that would be important for our audience to know right now from your organization or about the issues at hand in terms of down-ballot races that are maybe not getting the attention that they should locally, or anything else that you would like to say today that would be important for our audience to know?
Yeah, I would say before you cast your ballot, visit smartjusticemi.org and see where the candidates for prosecuting attorney in your community land on a number of key issues, whether that's decarceration, whether that's racial justice, transparency, broad accountability. We want voters to know how their candidates have pledged, and that they have a voice in electing folks who represent their values.
And with that, Jessica, just a quick question. One of the things that I found is when people are voting for prosecutors or judges, especially when it's a prosecutor, if you go through their campaign finance reform, all their payments, right, and their donations, so many of those donations come from the attorneys that are appearing before them. Is this a conflict of interest? To me, it just seems like a crazy way for us to elect our prosecutors as well as our judges, and then typically it's the people that are going to be standing before them to hear their cases heard are the ones who are donating, because they know who donates to their campaigns and who doesn't.
Sure. So for us, that's really where the transparency piece comes in. If the candidate, obviously campaign finance records are public record. And then if we've got prosecutors in office who are regularly and publicly posting data, we can then hold them accountable so that nothing goes untouched, and they're not able to have those conflicts of interest, and they're not able to do anything that might not be on par with what they pledged as a candidate.
Well, I think that's one of the things that you go back and you look, and in the Eric Smith case out of Macomb County, when you go back and you start looking at the campaign donations, you can see a pattern there. And so we encourage all people to do that. It is free for you to do an online search. So if you just Google your candidate's name, campaign donations, and it will take you to the link to the clerk's office for you to be able to do so. If you haven't voted yet, it's just another thing to try to do your homework before you go in and actually vote. Jessica, thank you so much for being with us. We appreciate your time.
Thank you.
Tyler and I are going to take a quick break here on the Oakland County Megacast. Just about, 30 minutes left. Actually, this show is good. It's flying by.
It really does fly by.
It
does.
Flying by, and that's from a girl who hasn't had any caffeine this morning, and it's still going by. So
it's that daylight saving time really helps.
Yeah, we forgot about that, right?
It's the only thing that helps.
Just about 20 minutes left here on the show, and when we come back, we'll be speaking with the stroke program coordinator over at the Henry Ford West Bloomfield Hospital. This is the Oakland County Megacast.
Michigan, we still need to stay careful, because we don't want to go backwards, back to where we started. So keep standing 6 feet apart, keep wearing a mask in public, and if you have symptoms, talk to a healthcare provider about getting tested. To move forward, let's all do our part. So stay careful. Michigan.gov/coronavirus. Michigan, we're calling on you to save lives. Don't ignore it. Don't let it go to voicemail. It's urgent. In fact, it's critical. Because if you've been in close contact with someone who tests positive for COVID-19, you may have been exposed to the virus. And you could get a call from My COVID Help or your local health department. So please answer the call to learn how to protect yourself, your family, and friends. We're calling on you to stop the spread of COVID-19, to make it safe to reopen businesses and help Michigan move forward. So if you get a call from My COVID Help or your local health department, you may have been exposed to someone with COVID-19. To protect us all, answer the call. Learn more at michigan.gov/containcovid. A message from the Michigan Department of Health and Human Services.
Thank you for hanging out with us on this Monday morning. I'm Ronnie Dahl here in the studios with Tyler Keefe. You can catch us Monday through Friday, 10 a.m. to noon, Civic Center TV, Birmingham area municipal access. Catch us on Channel 15 on Comcast, Channel 99 on AT&T. If you're out driving around, tune us into the radio, 89.3 Lakes FM, 88.1 FM The Biff. You can also catch us today on the West Bloomfield Township Clerk's Office. They are Facebook streaming today's Megacast on their Facebook page, so we want to say thank you to them. You know, every year more than 795 people in the United States have a stroke, and for us here in the greater West Bloomfield area, I think this issue came to light when Dan Gilbert suffered a stroke a couple years ago. It started the conversation going, and with us right now is going to be Cathryn Guina. She is a nurse over at the stroke program coordinator and the stroke program coordinator for the Henry Ford West Bloomfield Hospital. Thank you so much for being with us.
Thank you so much for having me.
And that's one of the things when Dan Gilbert suffered his stroke, he was fortunate enough to receive help almost immediately, which has helped aid in his recovery. But I believe when you have a high-profile person such as himself, who means so much to the business community here in the Detroit area, it allows us to start that conversation. For you, you live on the front lines of dealing with so many people with stroke victims. What do you want the public to know? Starting off with, what are the signs to look for?
Yeah, absolutely. This is a really, really important thing for everybody out in the community to know the signs of a stroke. So we use the acronym FAST, F-A-S-T. F stands for face. Your one side of your face droops down. Your smile might be uneven. The next is A, that's arm. Typically one side of your body is more weak than the other when you're having a stroke. So you test to hold your arms out and see if one arm is weaker than the other, or if when holding it out, your arm drifts down without intention. And S stands for speech. If your speech is slurred, garbled, you're having a difficult time processing thoughts or getting speech out. And then the last T is for time. And that's the most important thing, is that stroke is a true medical emergency. If you're experiencing one of those symptoms, the most important thing to do is call 911.
And with that, if someone thinks, like, is there a difference between a mini stroke? We hear that term, mini stroke. What exactly is that, and how is it different from a full-blown on stroke?
Sure. So a mini stroke is also called a TIA. And the difference between the two is that with a mini stroke, your symptoms usually resolve within 24 hours. A lot of the time, most people's symptoms last, just a few minutes, maybe an hour, but then it goes away. And the important thing about TIAs is that a great amount of people end up having a full-blown stroke after a TIA. So instead of calling it a mini stroke, looking at it as a warning stroke is a good indication. It's also treated the same as a medical emergency if you come to the hospital with those resolved symptoms. The goal is to figure out what are your risk factors for having a stroke. So getting a hold of your blood pressure, high cholesterol, managing diabetes, having some kind of lifestyle changes to be healthier and decrease your chance of having a full-blown stroke.
And Catherine, during the COVID-19 crisis, so many people have not wanted to go to the hospital. In this case, they need to go to the hospital.
Absolutely, every time. There are 2 different treatments that we offer at Henry Ford West Bloomfield for the treatment of acute stroke, and both of them are very time sensitive, just hours from the start of symptoms. So it's important to especially call 911. EMS has lots of connections with the hospital, and as soon as you arrive to the hospital, there will be a team in the emergency department to whisk you away and to really expedite the process to diagnose and treat your stroke. Everything at the hospital is still very safe. I know that COVID creates a lot of fear and panic and anxiety, but the hospital is still safe. Everybody wears a mask. Everybody is screened on their way into work. Everybody that comes into the hospital is also screened. So still really important, if you need urgent medical attention, to still come.
Cathryn Guina with us on the Oakland County Megacast. She's a nurse and the stroke program coordinator at Henry Ford West Bloomfield Hospital. And Catherine, you mentioned when we discussed symptoms that time is critically important in treating stroke. For those that may either experience stroke themselves or see the symptoms in a loved one or someone that they're working with, or just in the general public, how important are those minutes, and what those minutes, those seconds, those hours, and how much of a difference can they make both in the treatment of stroke and then ultimately the recovery as well?
Time is everything for both of those things. Like I had mentioned, the couple treatment options have to be within hours of symptom onset. So recognizing those symptoms and getting to the hospital right away is very, very important. And the quicker the stroke is treated, the better the outcome. So everybody, EMS, quick recognition when you come to the hospital, and then expedited care. Strokes are a true medical emergency. So when you arrive here with signs or symptoms of stroke, everything moves very, very quickly. Millions and millions of neurons, brain cells die every minute that you're having a stroke. So of course, it's very important to stop that process if possible, and then get right on the road to recovery.
And Catherine, what causes a stroke?
That's a great question. So there's two types of stroke. The more common stroke is called an ischemic stroke, and that is when a main blood vessel in your brain is blocked by a clot. So oxygen and good blood can't circulate through your brain, which causes those symptoms. And the other kind of stroke is a hemorrhagic stroke. So that's when that blood vessel in your brain has too much stress or pressure put on it, and it just bursts. That's most likely due to high blood pressure or hypertension. And ischemic strokes, the more common ones, can happen for a number of different reasons. Having uncontrolled high blood pressure, high cholesterol, uncontrolled diabetes, a history of clotting disorder with your blood. So strokes can happen for a number of reasons, and the most important thing is to look at your risk factors, figure out what would put you at greater risk for having that stroke.
And with that, and knowing that, I would think there are precautions that any person can take in just the way that they live their life to try to avoid becoming a victim of a stroke to begin with.
Absolutely. There are only a few risk factors that you can't control. So that's the good thing. The ones that you can't, your age, the more you age, the greater likelihood of having a stroke. So that's just kind of an unfortunate thing about that. Gender, women are more likely to have stroke. And family history of stroke, you can't control that risk factor. So my grandfather had a stroke, so that I know that I have a family history of stroke. So making sure that especially my parents and myself and my family members, as we get older, constantly looking at the other risk factors that we can control, like high blood pressure, high cholesterol, obesity, having a healthy diet, a nice well-rounded healthy lifestyle, exercising, making sure to follow with a primary care doctor to kind of take a look at the big picture.
If someone is diagnosed as suffering a stroke, what is the treatment, and can some of it be permanent damage?
There can be permanent damage from a stroke. There are a couple treatment options. If if the stroke symptoms are identified quickly, there's a medication called Alteplase. It's also called TPA, and it's a medication that's given through an infusion. And the goal is to dissolve the clot that is lodged in that vessel in your brain. So there's a handful of other qualifications that the person that's having the stroke has to meet, but like I said, it's usually given within 45 minutes of arrival to the hospital. And then if it's determined that that clot is just going to be stuck in a very specific part of the artery, there's a procedure where a physician can actually thread a wire up into that vessel and remove the clot from your brain. So those are the two treatments, and then from there, everything else that's done is based on all the other symptoms that the patient is experiencing.
Cathryn Guina with us on the Oakland County Megacast, nurse and the stroke program coordinator at Henry Ford West Bloomfield Hospital with us on the show today. And Catherine, there's a number of programs at Henry Ford West Bloomfield Hospital that that can help in prevention or help in treatment of stroke. What are some of those programs that are available, and how can people access them?
So at Henry Ford West Bloomfield, patients that come in that are diagnosed with stroke, there is a post-stroke clinic, a stroke neurologist that is able to see patients after they're discharged. I myself, follow up with patients at 7 days and 90 days, especially if they've had one of those procedures to abort the stroke. And then everybody is recommended to, continue following with their primary care physician. At that point, a lot of stroke patients need some rehabilitation. So sent to an inpatient rehab unit or a subacute rehab for a little extra help and focus on gaining back physical mobility, cognitive restoration, just getting back to having good quality of life afterwards.
Cathryn Guina with us here on the Oakland County Megacast. She is the stroke program coordinator over at Henry Ford West Bloomfield Hospital. Just a couple more minutes with you here on this show. Anything that we didn't ask that you are the expert in your field that maybe we didn't ask that you want others to know?
I think the most important things you have definitely touched on already. Stroke is a true medical emergency. Sometimes the symptoms don't seem very severe, but in any situation, I think it's important for everybody to call 911 right away. Come into the hospital. You'll be safe here, well taken care of. A lot of really, really great stroke care being done in the community right here.
And if someone does suffer a stroke and they survive it, are they more likely then to have another stroke later?
Yeah, so that does happen. That's another one of those risk factors that you can't control. If you have had one, you could have another. Your likelihood of having a second one is greater than somebody who hasn't had one before. But again, after having a stroke, you're placed on specific medications to kind of manage everything else that could be happening in your body that would contribute to having another stroke.
And with that, quickly, if someone is admitted to the hospital, what are your visitor procedures right now with COVID?
So with COVID, all visitors are screened at the front door, which means a number of questions, your temperature taken. All visitors have to wear a mask. And I'm not sure what the hours are for visiting in urgent situations. There are exceptions, and the nursing staff, if you're visiting a patient on a specific unit, would definitely be the people to go to for that.
Catherine, thank you so much for being with us. We so appreciate your time and all your expertise as well. It's so important for people, as you said, to get help and to do it sooner rather than later, because the quicker they act on a stroke, the less likely they'll have long-term disability from that stroke.
Yes, exactly.
Well, thank you so much, and thank you to you and the entire team over at the Henry Ford West Bloomfield Hospital. We appreciate your time today.
Thank you so much.
Always good information. I think Dan Gilbert, when he had his stroke, it really brought the conversation about strokes and the importance of being able to get it treated right away. The sooner the better. In that area, we have family members that have suffered strokes, and one is in a long-term care facility now because, it's horrible to see your family members go through that. So look for the signs, know the signs. And if you notice it, especially in someone else, because sometimes they may not notice it or recognize it. So if you notice that in one of your loved ones, if you are going to be around them for the holidays, and if you see something, please go ahead and take precautions and get them to the hospital, because it is safe to go to the hospitals now as well.
Yeah, it is. And like Catherine had said, it's so important that this is addressed in a timely manner, not only because it determines the treatment for stroke in some capacity and the effectiveness of that treatment, but also because it impacts the recovery. Catherine even said in the interview that the quicker you get in to the hospital to get that treated, the better the outcome is going to be, is likely to be. The better the outcome is likely to be from the treatment you get for stroke, which could possibly impact your chances for another stroke down the line, or how long of a recovery you have to deal with post-stroke and post-treatment as you're trying to recover and get back to some semblance of normalcy.
The CDC, go to cdc.gov. They have a lot of great information on their page about strokes, the signs, what you should be looking for as well, along with the lifestyle you should be living to help prevent a stroke, and especially if you have some of those warning signs such as high blood pressure. We hear the saying so many times, don't have a stroke. When people are like, crazy anxious, well, there's actually, a reason, because high blood pressure does contribute to suffering a stroke. That pretty much is going to wrap it up for today's edition of the Oakland County Megacast. We want to say thank you to all of our guests for being with us today. And just as a reminder, you can also catch the interviews if you missed them today. Just go on to our website, civiccentertv.com. You can catch the full Megacast along with previous Megacasts as well. And Tyler also takes the interviews, cuts them down, so that if you just missed one interview today, maybe you want to hear again from Deanna with the West Bloomfield School District on their decision to go remote learning. You can find that over on civiccentertv.com. So we want to say thank you for that. Tyler, as always, thank you for all of your hard work and all that you do, as well as Jake and Larry for helping us get the guest on the air and book all of our guests. And of course, it is election eve. Go ahead, if you have not voted as of yet, you can go on, get a sample ballot, do your homework before you walk into the poll tomorrow, figure out who you're going to vote for, do a little bit of homework, and then go and cast your ballot.
Yes, and today, of course, we are on the West Bloomfield Clerk's Facebook page. They have been advocating for the last several days, really well over 2 weeks now, that don't delay, turn in your absentee ballot today. If you haven't turned it in yet, definitely don't mail it. It will not get to your clerk most likely by the time polls close on election day. You got to deliver them directly to your clerk's office. I believe that today is the last day that you can go and get an absentee ballot up to sometime this afternoon. Otherwise, you'll have to vote in person if you register the same day. And then, of course, you can find more information. If you're in West Bloomfield and you have questions, the clerk's office is on standby. They do great work over there answering questions in a timely manner and helping people through this. In terms of our coverage of the election, we will not have live election results on our channel tomorrow night. We will be directing you to the Oakland County election results page from our website. We will have a link on our page tomorrow afternoon. We will put that up at the end of our regular business hours. And then on Wednesday morning show, hopefully by then we should have most of the results from the four communities, West Bloomfield, Kegel Harbor, Sylvan Lake, and Orchard Lake, and begin to be able to provide those results to the public and speak to some of the winning candidates and local officials as well.
Fingers crossed. Let's hope those results come in early. This has been the Oakland County Megacast.